Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering various questions and addressing the latest COVID headlines through today, December 20th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bykowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
In the United States, yesterday, we saw 57,000 positive new cases with our 7-day average at about 65 to 66,000 positive new cases. With a 24% increase over the last 7 days, hospitalizations have increased by 11% and the death rate has increased by 59%. In Illinois, we saw a startling number of 9,000 positive new cases yesterday. With cases increasing by just a little bit, fortunately, hospitalizations have increased by 13% and the death rate is increasing also by 13%. The 7-day average in Illinois is about 3,500 cases per day. Okay, Dr. Murphy, what can you tell us about these spikes that we're seeing everywhere? Is this it? Is this the winter surge?
Well, this is the winter wave that has been predicted and is now coming through the population, along with flu and respiratory syncytial virus. What's happening now is that the cases are picking up as people are moving around, especially for the holiday. There was a blip up starting after Thanksgiving when people were moving, and now with Christmas, that will continue the movement and spread of these viruses. So it looks like respiratory syncytial virus, RSV, is actually going down. So that part of the epidemic is declining naturally for whatever reason, we don't know, but flu has really taken off. And this is when flu does take off. So flu came early, but now it's starting to really shoot up. And then COVID, which doesn't follow really any rules, is up all over the place, primarily because, very few people are wearing masks. They're not mitigating enough. Several areas around Chicago have reached the high level, the DeKalb area and Kankakee areas. Those are at the high level at this particular point. Chicago is still medium, but it's a mixed bag throughout the state. So, the word is now, with the recommendation is now that throughout the holidays, you got to really be careful. People should be wearing masks if at all possible when they're indoors or in an airplane or bus or subway or something. Probably wearing a mask is going to be helpful for you.
Yeah, absolutely. And going into our first COVID headline, which touches closely into what you're saying, is the new COVID booster shots are cutting risk of hospitalizations by half, CDC is now reporting. This is huge news. So what can you tell us about this?
Yeah, so, the new bivalent vaccine came out in around September. And it's a mixture of a vaccine that's designed against the Omicron variants, which are circulating now, and the old vaccine. So it's half and half. And this is for both Moderna and for Pfizer. There has been they approved it based on laboratory tests, basically. Just like they do with the flu. The flu shots that come out are not tested actually against the new flu, but they design them against the expected variants that are going to be out there. So this is the first data that has come out looking at the new vaccine compared to the old vaccine or people that haven't had a booster. And the news is good. It shows that the updated booster overall had a 57% chance, lower risk, this is all comers, of hospitalization compared to those that are unvaccinated with the new booster. And then you can break this down a little bit. It was 38% lower risk compared to people who had recently received doses of the original vaccine. So their last booster was the original one. So it's not quite as much. And a 45% lower risk compared to those who had the original vaccine as a booster more than 11 months ago. So for about a year ago. So a lot of people are not up to date on the boosters. And matter of fact, fewer than 20% of American adults and only 1/3 of people over 65, which is the highest risk group, have taken this new vaccine. But
Yeah.
it's just very dramatic how effective this vaccine is. 50% is good. I mean, if you, that's not a bad outcome, especially in the very high risk groups. So it's just some nice clinical data that shows that, you know, taking these boosters is really going to help you, and get it now, because we're heading into this, you know, big peak, the end of December and January. And, you know, you don't want to get infected. You don't want to get really sick and end up in the hospital. So please get your boosters. This data is very compelling.
Yeah, no,
Safe.
absolutely.
Mhm.
Well, that, you know, what you're talking about is getting in the new booster is important, is that another big headline right now is that the triple endemic viruses are still spreading. So what do we know about what is going on with RSV, flu, and COVID, and even the cold?
Yeah. So as I mentioned, RSV is going down, flu is going up, COVID is up. And you know, the question really is, when are you contagious for these things? And in general, the contagious period starts a little bit before you get sick, like the day before, 2 days before you get sick. The virus level goes up, then you get sick, it continues to peak, but your immune system, you know, starts to fight it, and then the virus comes down over a week or so. That's sort of the general thing that happens. So you're contagious, and with COVID in particular, you know, it's about 10 days since your symptoms start or your test is positive. If you're asymptomatic, but your test turns positive, 10 days, most of the people are not infectious anymore. And the guidelines are, for the first 5 of those days, you should stay away from people. And if you have to be around people, you know, wear a good mask. And then the second 5 days, you can, if you're feeling better, you can go out, but you should be wearing a mask for at least the second 5 days as well. So it's that 10-day period from the positive test with no symptoms or your first symptom. Like say you get symptoms on Sunday, you don't get tested till Wednesday. Well, your day 0 is Sunday, not the day of your test. Okay.
Mm-hmm.
Now, say somebody in your family has COVID, or somebody you work with or whatever. You get exposed to them, you do a test on Sunday and it's positive, but you feel fine. Okay, that's day 0 also, that first positive test. And then you're going to get sick on Monday or Tuesday, but your day 0 is the day of your first test. That's positive.
Right. Yes. And then last but not least, Dr. Murphy, you know, as you just mentioned that the flu is going down, our last big headline is that fortunately we are seeing a downfall in the flu, but we're seeing an uptake in the flu. So here I want to show a graphic.
Yeah, show that graphic.
Yeah, there we go. Can you tell us a little bit about what we observe in this graphic?
It's pretty dramatic. So this is and the week ending December up till December 10th. So, you know, we're already past that time, 10 days later. But look at the pattern here. So the blue is RSV. And as I mentioned, it looks like that peaked at the beginning of November. And then it's coming down very nicely. But look what's happening with flu. It started a little early this year. That's the purple. And it's just skyrocketing right now. So, and COVID has just been cruising around in the middle and going up now. And remember, the problem with the COVID cases is that so many of them are getting diagnosed by home tests that it's very much still underreported. Now, in the near future, we're going to see home tests for flu and RSV and all sorts of other pathogens. I mean, the future is very bright in terms of diagnostics. So people are going to be making their own diagnosis pretty much from here out. And there'll likely be test cards that have like 4 lines, like you would put the specimen in and it'll tell you, oh, you have flu A, flu B, RSV, COVID, whatever it is you have on the test card. So the future is very bright for
Well, that's
diagnosis.
wonderful. And then Dr. Murphy, transitioning to our viewer submitted questions. The first question / we want you to hear more from you information from is there are times that you have mentioned that there are new treatments for COVID in the works, as well as new types of vaccines, some of which are pan-coronaviruses. Can you talk more about what is going on with these new treatments?
Yeah. So, the position that was taken early on was that we'll put all our effort in the vaccines and get rid of this thing. And of course, that didn't work for a variety of reasons. So now COVID is endemic around the world. The pandemic is winding down in certain areas, but it's taking off like crazy in China now. They're estimating that somewhere between 600,000 and 1 million people may die.
Wow.
Because it's like starting the whole epidemic over there again. They have one of the lowest death rates now. I mean, in the, I don't know the number, but in the tens of thousands compared to the United States, which is 1.1 million. But that's because of their zero tolerance policy. But now they can't keep living like that. And so they've loosened things up. So the cases are going to skyrocket in China right now. So anyhow, but the focus has always been on vaccines and the impact of the vaccines. And, we were able to hit it out of the park. In 2020, the vaccines got developed in 10 months, and they worked way better than expected. Originally, we thought, 50% is good. And they were working like 90% effective originally. So, as we talked about in that paper last week, the impact of the vaccines has saved 3.2 million lives. I mean, it's just phenomenal. 1.1 million have died, but 3.2 million survived because of the vaccines. Imagine if we had only 2.8 million people die per year of everything combined. What if we had another 3.2 million? That's devastating for the hospital system. The hospital system will collapse. So anyhow, we can't vaccinate our way out of this thing. And we have some drugs. The monoclonal antibodies don't work anymore. The virus has mutated around them. They were very helpful for a brief period of time. We have Paxlovid, which is a pill given primarily to outpatients, 5 days of that. There's a lot of drug-drug interactions with Paxlovid. But it's just a 5-day treatment, just like Tamiflu is a 5-day treatment for flu. And so then we have remdesivir. Remdesivir is given intravenously, so it's mostly for hospitalized patients. They get remdesivir. It's clunky to give intravenous. It works as an outpatient, but you got to take it IV, and so it doesn't happen all that often. There's a second drug out there, molnupiravir, that Merck is distributing, but the efficacy of that is much less than Paxlovid. Paxlovid is quite potent with about a 90% reduction in hospitalization, whether you're vaccinated or not. Now, so you have, one that's only given intravenously. You have the antibodies are out. You've got one that works like 90%. You got the hospital one and one that doesn't work so good. The one that doesn't work so good by Merck, it doesn't have as many drug-drug interactions. So there's, in some cases, you may have to use that drug. But the good news is now that things are sort of revving up in the treatment world, there are multiple drugs in development. I keep alluding to this. The three that are the furthest along are Ensovibep. It's a Swiss drug being developed. Excova is a Japanese drug made by Shionogi, has started already a phase 3 trial. That's the trial that leads to approval. And bemnifosbuvir is a drug from a small company in Boston. They launched their phase 3 trial last month. And hopefully they'll have news of the response to these drugs. These drugs look very good in the laboratory tests. And so, everyone has a lot of hope in them. And then the thing is, since this isn't going away, perhaps some of these drugs will need to be combined together, like a combo type pill. Because it looks like COVID is going to be around like forever. So in those cases, if you're at risk, once you get it, if you want to like drop your hospitalization rate or mortality rate even further than with just the vaccines, or if you never got the boosters or you never took the vaccine for whatever reason, you're now going to have, probably some of these other treatments available to you. So Paxlovid is available to everyone. The government is still paying for it. They pre-purchased the drug for anybody right now. Now that's going to end unless Congress changes their mind. It's really going to be horrible because it's going to cost a lot of money. It could cost as much as $700 for a treatment course. Now, insurance, of course, will pay for it, and in most cases, or they're going to mandate that they pay for it. But it works better and it's cheaper if the government just pre-purchases everything, because they get a giant discount.
Right.
They get volume discounts. So,
Right.
But anyway, in the near future, in the not too distant future, in the next 12 months, you're likely to see at least one or more of those three drugs I mentioned be available. So there'll be other options for people.
Yeah, absolutely. Well, Dr. Murphy, those were all of our viewers' many questions for this week, and we will touch base with you probably after the holidays. And we look forward
Yes,
to.
I think we'll take a little break over the holidays, and we'll see you again the first week of January. Have a very happy holiday season.
Yes. Thank you, Dr. Murphy.
Bye-bye.